Well, welcome back, everyone. Today we are joined by Dr. Vahid Tavakoli. He's from the Lima Memorial Heart and Vascular Institute, and he's going to be talking about the WATCHMAN procedure that's offered at Lima Memorial. Now, this is an alternative to the lifelong use of blood thinners for individuals with non-valvular atrial fibrillation. So thanks so much for joining us, Doctor.
Hello, Chris, and thank you for having me.
Yeah, my pleasure. Well, firstly, can you tell us more about atrial fibrillation and why those with it might just need some blood thinners?
So the heart has top chamber and bottom chambers, and these chambers are all in harmony in a normal day. In AFib, these chambers fall out of harmony. So the top chamber fibrillates on its own, and the bottom chambers, they're all on their own. When the top chamber fibrillates, it's not really pumping. It's not really moving blood. So the blood is going to be stagnant there. And stagnant blood can cause a clot formation. And what can a clot do? The clot can go to the brain and cause a stroke. And that's why for patients with AFib or atrial fibrillation, we give a blood thinner to thin the blood, because that stagnant blood is a danger, and a stroke is horrible.
Yeah, so that is definitely true. So how does the WATCHMAN FLX device work in comparison to using blood thinners?
So there is a history behind these blood thinners. First time when doctors noticed that AFib and a stroke are associated, they had only one option. It was warfarin, Coumadin. And it was horrible. People needed to be tested every week or every 2 weeks. And they were miserable. Eventually, with the progress of medicine, we had another new medications, and they did not need testing, but they were still blood thinners. You would bleed on them if you had fall on them, if you had an accident on them, if you had a bleeding from your stomach on them, it would be horrible. So it was not an ideal option. Recently, we have a new device, which is called WATCHMAN, and it's a seal. And the reason it's a seal is, the reason a clot is formed is because of a pouch on top of the heart. It's somewhere called left atrium. It's also called left atrial appendage. I'm just going to call it pouch. And that pouch is the culprit for all these strokes. If we seal that off, you will not need any big blood thinner anymore. And just a baby aspirin would be eventually fine for you. And people bleed a lot less on a baby aspirin compared to real tough blood thinners. And if with a procedure I can get a patient who is at high risk for fall and bleeding, that would be really, really amazing.
Yeah, that's fascinating. So what can a patient expect before, during, and after the procedure?
So before doing the procedure, we want to see how exactly the shape of your heart and shape of your pouch is. It's amazing. Pouches are different. Everybody's pouch is different than someone else's. This culprit pouch that causes the stroke, it's sometimes like a cactus in some people. It's sometimes like a cauliflower, and sometimes like a chicken wing. We literally call it chicken wing. And we have to plan how to seal it. And we have to, imagine you want to go from here to Chicago. You pull up your GPS, and GPS gives you the best planning route there, where you have the best chances. And before doing this procedure, WATCHMAN for you, we do a CAT scan for your heart. And we put everything in 3D, and we use AI to plan the best route of doing this. It's partly art, partly science. You have to go exactly through the right place in the groin, all the way to the heart, make a hole through the heart, go to the other side of the heart, and seal that pouch in the best possible way that leaves no residuals. So before the procedure, you're going to need a CAT scan and some planning ahead. Through the procedure, we're going to sedate you. So you will not have any pain. You will not remember it. And it's going to be about 45 minutes until we are done. And after the procedure, we'll monitor you. We make sure that things go well before we send you home. So it may be 24 hours of observation. And when you go home, after about 4 to 6 weeks, we'll do a follow-up picture from you. We go inside your food pipe with a camera, we'll take pictures, we make sure everything is well sealed, and then we'll take off of the blood thinners.
Wow, quick procedure. All right. So if a patient is interested in learning more about the WATCHMAN FLX device or just scheduling an appointment with you, how can they reach out?
So we have a dedicated structural heart program here. And we have an expert, Natalie, who is dedicated to doing all these things. And if you call them, they will give you all sorts of help. And they will tell you if WATCHMAN procedure is optimal for you and what to do next.
All right, awesome. Well, doctor, I want to appreciate you coming out today. I love that. Thank you so much.
Thank you, Chris.
All right, well, don't go away because we have more when we return.